Inside the intensive care unit at Baharlu Hospital in Tehran, patients urgently need life-saving medications. Some are battling drug poisoning, others face cardiac issues or cancer. But hope is fading. Pharmacies, once a lifeline, have become symbols of despair. Queues stretch around the block, and patients are left with few options. More than 100 essential drugs, including antibiotics and cancer treatments, are either missing or priced beyond the reach for many.
Patients who've used methadone or other narcotics need an antidote. For certain cases of poisoning, life support machines could save lives, but they're extremely costly and inaccessible.
Iranian authorities say 90% of country's medications are produced domestically, but some question their effectiveness. The remaining 10%, often vital for critically ill patients, are only partially available in government-run pharmacies, and even then, they're hard to find and expensive. In Iran, the government frequently blames international sanctions for the country's healthcare challenges. But while sanctions play a role, many patients say mismanagement is also an issue. They say there is no clear strategy for supplying critical medications, and regulations lack transparency. As a result, the black market, flooded with counterfeit or overpriced drugs, is becoming a shadow healthcare system. Healthcare workers, pharmacists, and citizens are demanding transparency and regulation. Some Iranians are taking matters into their own hands. Mehdi Sururi runs an informal charity funded by friends and philanthropists. He purchases medications and distributes them to patients who can't afford them. But he says the task is exhausting. Either the drugs are unavailable or their prices keep soaring.
Raising money is an issue, but the medicine itself is nowhere. Prices change overnight. Even basic items such as pediatric cannulas are missing. Hospitals often use adult ones for children. When we ask, they just say, "This is all we have."
In January, Iran's health minister lifted price caps to help pharmaceuticals manage rising production costs. But for patients, this has only made treatments more expensive, worsening a crisis caused by economic strain, bureaucratic failure, and a disrupted global supply chain. Resul Serdar, Al Jazeera, Tehran.
Don't miss out. Get the full picture. Subscribe to Al Jazeera for reliable news, expert insight. Like, share, stay ahead.